Kidney infection, also known as pyelonephritis, is a type of urinary tract infection (UTI) that starts in the urethra or bladder and travels up to one or both kidneys. It can be serious if not treated promptly, as it may lead to kidney damage or the infection spreading to the bloodstream. Causes: kidney infections are usually caused by bacteria, most commonly Escherichia coli E. coli, which normally live in the intestines. The infection generally begins as a lower urinary tract infection in the bladder or urethra and ascends to the kidneys. Less commonly, the infection can originate from other parts of the body and spread to the kidneys via the bloodstream. Risk factors: certain factors increase the likelihood of developing the kidney infection. Female anatomy: women are at greater risk due to their shorter urethra, which makes it easier for bacteria to reach the bladder and then ascend to the kidneys. Urinary tract obstruction: conditions like kidney stones, an enlarged prostate, or other blockages can obstruct urine flow and increase the risk of infection. Weakened immune system: people with weakened immune systems, such as those with diabetes, HIV/AIDS, or those on immunosuppressive drugs, are more vulnerable to infections. Urinary catheters: the use of urinary catheters can introduce bacteria into the urinary tract. Vesicoureteral reflux (VUR), the condition where urine flows backward from the bladder into the kidneys, increasing the risk of infection. Pregnancy: hormonal and physical changes during pregnancy can make women more susceptible to urinary tract infections and, subsequently, kidney infections. Symptoms: kidney infections often cause more severe symptoms than lower UTIs and can come on suddenly. Common symptoms include fever and chills. A high fever over 101 degrees F or 38.5 degrees C and shaking chills are common indicators of kidney infection. Pain: flank pain, severe pain or tenderness in the lower back or side, usually on one side. Abdominal or groin pain: pain may spread to the lower abdomen or groin. Frequent, painful urination: a burning sensation when urinating or a frequent urge to urinate, even if little urine is passed. Cloudy, foul-smelling, or bloody urine: urine may appear cloudy, have a strong odor, or contain blood hematuria. Nausea and vomiting: gastrointestinal symptoms like nausea and vomiting are common with kidney infections. Fatigue and malaise: the general feeling of illness, tiredness, or weakness may accompany the infection. Confusion or mental changes: in older adults, the kidney infection can cause confusion or other mental changes, often without the typical urinary symptoms. Diagnosis: diagnosing the kidney infection involves a combination of clinical assessment, laboratory tests, and sometimes imaging. Medical history and physical exam: the doctor will ask about symptoms and perform a physical examination, focusing on the lower back where kidney pain is typically felt. Urine tests: urinalysis: the sample of urine is tested for the presence of white blood cells, bacteria, or blood, indicating infection. Urine culture: identifies the specific bacteria causing the infection to determine the most effective antibiotic treatment. Blood tests: complete blood count (CBC) may show elevated white blood cells, indicating infection. Blood cultures: in severe cases, these may be done to check if the infection has spread to the bloodstream. Imaging: ultrasound or CT scan may be used if there is concern about complications like kidney stones, abscesses, or structural abnormalities in the kidneys. Treatment: the primary treatment for kidney infections is antibiotics. Hospitalization may be required for more severe cases, especially if the patient is unable to take oral medication or if the infection has spread to the bloodstream. Antibiotics: oral antibiotics, typically a course of 7 to 14 days, depending on the severity. Common antibiotics include ciprofloxacin, levofloxacin, or trimethoprim sulfamethoxazole. Intravenous IV antibiotics: in more serious cases, antibiotics are administered directly into the bloodstream in a hospital setting. Pain management. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help reduce pain and fever. Fluids. Drinking plenty of fluids helps flush bacteria from the urinary tract and prevents dehydration, especially if the patient is vomiting. Hospitalization may be necessary if the infection is severe, if the patient is pregnant, or if there is a risk of complications like sepsis. Complications if left untreated or if treatment is delayed. The kidney infection can lead to serious complications, such as chronic kidney disease. Repeated or severe kidney infections can cause permanent damage to the kidneys, leading to chronic kidney disease. Sepsis. The infection can spread to the bloodstream, causing a life-threatening condition known as septicemia or sepsis. Kidney abscesses. Pockets of pus may form in the kidneys as a result of untreated infections, requiring drainage or surgery. Acute kidney failure. In some cases, the kidneys may suddenly lose their ability to filter waste from the blood. Recurrent infections. People who have one kidney infection are at higher risk for future infections, especially if the underlying cause such as BUR or kidney stones is not addressed. Preventing kidney infections involves steps to reduce the risk of UTIs and to address any underlying conditions. Hydration. Drinking plenty of water helps flush bacteria from the urinary tract. Proper hygiene. Wiping from front to back after using the toilet reduces the chance of bacteria from the rectum entering the urethra. Urination habits. Urinate frequently and empty the bladder fully. It's especially important to urinate after sexual activity to help clear bacteria from the urethra. Avoid irritants. Avoid using feminine products that may irritate the urethra, such as douches or powders. Treat underlying health conditions. Managing conditions like kidney stones or an enlarged prostate can help reduce the risk of infections. Conclusion: the kidney infection is a serious condition that requires prompt medical attention. With early diagnosis and appropriate antibiotic treatment, most people recover fully. However, untreated or severe infections can lead to long-term complications, including kidney damage or sepsis. It's important to manage urinary tract infections early to prevent them from ascending to the kidneys.